Tamara, I just want to ask something you mentioned earlier that you almost all of your patients that are hearing aid candidates, you trial them at least with two devices. Wow. So I want to know from you, is there some sort of sense that you have when you do that? Is it usually the second device, and you probably alternate? You obviously don't have to go into to specifics, but you alternate which device you give first and which one second. Do you find that because of the adaptation period to hearing aids that they usually go for the one that they trialed second, or is it a mixed bag of outcomes?
Sarah, that is definitely a very good question. You know what? I have my own little scientific experiment going on the background, an Excel spreadsheet, because all the reps are dying to see that spreadsheet of mine. Because exactly of that, everyone's assumption is that most patients will then choose their second choice. And yes, I want to emphasize every single patient get a trial with two different devices. And the biggest reason for me is I think it's important to realize, yes, from our side, there are many things that our settings need to be correct and we need to verify and all of that. But hearing aids do sound very different because of the fact that everyone has their proprietary settings and algorithms that they use to amplify the sound with. And if you then bring in the new component of connectivity, apps look different, streaming works different. So that also influences patients' decisions. And I do alternate, but it's not, if I look at my stats of last year, because I actually went and took all that data of last year to see what was the most popular hearing aid in my practice and all of that, it's definitely not a thing of 100% of patients choose the second one. There is definitely a period of adaptation, but patients are sometimes very clever to say for themselves, now with the second one, maybe XYZ didn't bother me that much because I've already had a week trial with a hearing aid. I only give them 1 week with each technology. So it's not such a long period that I think it can have such a massive effect if you've only worn hearing aids for a week. And as you know, most patients, if you already put them on target at the first or their verified targets, it is a bit too much. So in any case, for those first 2 weeks, they are sometimes slightly under, say at 90% of that. I try always to do a trial with 100%, but most patients say it's a bit too overwhelming. It's more important for me for them to listen to the sound quality, to take it for a test drive in noisy environments. And that is the most important thing that I see coming from my patients is what hearing aids do in noise. We know that's our biggest challenge. We know that is what all companies are working towards, is to have better hearing in noise. And it is quite interesting how patients will specifically come back and say, with this hearing aid in noise, it was absolutely terrible, or I could hear, or whatever the case may be. So patients hear the difference. We are really at a point with technology where patients can hear the difference. I'm all about choice. And the best thing is when reps come to visit me, I always say, you can't be upset with me because I don't fit your hearing aid. My patient doesn't choose it. It's my patients that are deciding. It's not me. And I think from an ethical, moral standpoint, it makes me sleep at night because I never feel that I'm making a choice for ulterior motive or for my own clinical audiological choice. Because it is interesting. I think all of us are biased and we do have a slight preference for one or the other. And it's sometimes on paper that we are impressed with a hearing aid. But it's always interesting then to see if this hearing aid is in the real world environment, what patients' feedback are. And there are some specific cases where I will make specific recommendations, clinical recommendations in terms of a hearing aid, where there's certain features where I feel, but I do need this to give a patient access. But for most patients, they are part of the process.
Well, it certainly sounds like you very much are one of those people that is offering the best standard of care for all of your patients, and not only offering them choice tomorrow, but really offering them such comprehensive services from the diagnosis and through to all of the options that are available to them. So we at APPF are very, very fortunate to have you a member. And also the public will be very, very fortunate to have you as part of I Am member, the Independent Audiologist Matrix, because you fall very perfectly within a special scope of audiology, not just independent private practice, but someone who is offering their patients a standard of care that is equivalent to any international benchmark. So thank you for all your passion for the industry and for your patients and for all of our patients, because it's against you that your patients will compare everyone else should they decide that they ever need to see anyone else, or you decide that you want to retire, which probably won't happen anytime soon because you're only in your 20s. But I just wanted to say thank you very much for your passion as a human